After viewing this video, you'll be able to talk about how real-world application is a huge part of our healthcare digital story. You're going to know who the competition is and how we're preparing students for their careers.
Digital learning environments are great ways to bring relevance, engagement, and critical thinking to life in the classroom or as homework. We already know technology has become such an everyday part of students' lives that they've been tagged as digital natives because they've been introduced to multimedia since day one, and that is the perfect way to introduce students to new areas and help them retain the information. The real wow factor throughout our MindTap learning paths for healthcare are when we get to the portion that has elevated the thinking all the way up to where it's application. Application and critical thinking for healthcare are extremely important, and they are skills that the employers are looking for. I'm launching the Learning Lab for medical terminology. We've got these included with numerous of our other healthcare MindTaps. 6 out of the 8, but all 8 do contain some sort of application activities.
Welcome to Medical Terminology for Health Professions, Chapter 3, The Skeletal System. In this learning lab, you will perform a pre-assessment, a series of learning activities including X-ray determination, physician transcription, and medical record spell check, and a post-assessment. If you need assistance, you can click on your mentor, Technician Lainey Guzman, for help.
We'll skip the pre-assessment, but each has pre-assessment, activities, and post-assessment.
There you are. Thanks for coming down. Although we could have used you a half hour ago. I don't remember. Have you worked radiology before?
Not a lot.
Well, it's going to be trial films, right?
Yes, no problem.
Good. Patients are waiting. Room C is open. Let me know when you're done.
When instructors see this level of activity, they're blown away. Make sure you're showing these on all of your sales calls. Sometimes we'll get them wrong. And you can review the correct answer. This is all meant for additional practice for the student to build that confidence that they can handle whatever's going to be thrown at them while on the job and get the immediate feedback.
Thanks for giving me a hand with those patients. Next, I'll need your help translating these radiology notes.
In this activity, the students click on the term and have to select the correct definition. Know which ones I've got incorrect in red and the ones correct are highlighted in green. After completion, we'll be able to review the correct answers. As such.
Oh, good, you're done. I have your last task of the day. Here's a set of examination records that Dr. Forenza, our chief radiologist, dropped off this afternoon. He complained that there were so many spelling errors that they were basically unreadable. Please fix them so I can give them back to him pronto.
Spelling meeting the objectives of the course for medical terminology.
I'm going to be honest with you. I think you really have to go back and hit the books on skeletal system terminology because, well, just based on what I've given you today, I don't see that you have a good working knowledge.
And then the post-assessment. It's important that you have an understanding and you're able to demonstrate a knowledge of the different levels of activity within a learning path that elevate thinking and guide students to a desired learning outcome. You're going to want to be able to speak to the benefits of how the activities we've selected and built into the learning path are the basis of how we help to guide the students up the hierarchy of learning, from basic memorization and understanding to application and getting students to think critically on the job. For instance, level 1 activities here at the lower order of thinking are really anything within the learning path that help the students to retain the basic knowledge from all of those concepts that are presented. These are the readings, the videos, the flashcards, the animations. The mid-level range are those activities that were specifically drawn out to meet those objectives of the course. In this example, it's medical terminology, and those activities are spelling bee and word building. Now the students are going to start to master medical terminology as a language skill. Then at the higher order of thinking, this highest level, we're putting that language skill to use. Students are acting like professionals in a healthcare setting. Out of our 8 MindTaps, we do have 6 learning labs, but more importantly, we can call all of these things application activities. How are we taking the concepts we've learned and applying them to on-the-job skills? Some other examples are, for anatomy and physiology, it's image labeling and knowing the body, and pharmacology, it's how the body reacts to different drugs. For human diseases, it's knowing signs and symptoms, identifying diagnosis, and knowing the treatments. This is all relevant because a coder or a transcriptionist may only get partial information and should know how to fill in the blanks. Maybe they don't get the correct diagnosis from a physician and they need to put that information in properly. For our intro survey course, it's the career exploration, it's the critical thinking. All types of healthcare occupations are covered. For medical assisting, it's a learning lab and also a critical thinking challenge. Critical thinking challenge is a 3-month externship simulation where learners are confronted with a series of situations in which they'll have to use critical thinking skills to select the most correct action in response to the situation. Helps with for understanding health insurance and also the medical insurance billing and coding ICD-10. It's the learning lab, but also SimClaim. And SimClaim is practice software that familiarizes learners with the electronic version of a CMS 1500 claim form. All of this is real-world application.
You need to know who we're up against. Elsevier is a healthcare publisher, and they're everywhere. There's never been a conference I've attended they haven't been at. Evolve is their strong portal presence. It provides one-stop shopping for the customer. PageBurst. This is an e-reader with some note-taking capabilities, limited multimedia and quizzing. There's no read speaker, there's no learning path or chunked-out reading. It doesn't make anything easier on the student. No activity, certainly no high-level interactivity. No real-world application of the concepts. McGraw-Hill, their Connect, Learn Smart story is very strong. There's a message out there about adaptive learning. The active sim when it comes to medical assisting. Pearson. They have MyLabs. There's no customization. There is no distinct learning path. It's a bunch of activities, but there's no direction. The simulations look elementary. We have MindTap. We have learning labs. Real-world simulations. We have real-world application activities that meet the objectives of a given healthcare course. We have a strong portal presence as well. Let your customers know about their single sign-on accounts for faculty to gain all of their instructor resources, for students to gain valuable resources. And why do we do this? To help our customers and our students. Students to get jobs, to prepare them for their careers.